So, hi everyone, I am Shreyan Chatterjee, your immediate senior, and I'll be starting with your bones part, anatomy bones. In your first semester, you all will be having most probably superior extremity, you have it, and most probably you will have head and neck, right? Head and neck. So, আজকে আমি প্রথম বোন যেটা সুপেক্সের হচ্ছে ক্ল্যাভিকল সেটা আমি পড়াবো. But before that, let me introduce you to the bones viva, what actually is asked in your viva exam. So bones viva-তে তোদেরকে বলতে হবে প্রথমত description of the bone, okay, the description of the bone, and then you need to tell the muscle attachments. Under the description, you all need to first tell you need to first determine the side of the bone, and then you have to hold it in anatomical position, right? Then you need to mention its surfaces, and then you need to mention its borders. Description এখানে হয়ে গেল. After that, the examiner will ask you about the muscle attachments, okay? So this is how you need to appear, you need to actually answer in your bones viva, okay? Starting with supex. Before I go into the bones part, I talk about the bones, you should be very much familiar with these muscles, okay, with the names of these muscles: pectoralis major, pectoralis minor, serratus anterior, and deltoid. আরও কয়েকটা আছে যেমনি teres major, teres minor, but we'll come to that later on, right? But these are very important muscles which you must be knowing, and এগুলো জেনে রাখলে it will help you all in understanding এদের origin কোথায় আছে, এদের insertion কোথায় আছে, ঠিক আছে? Whenever you are describing a bone, you need to mention its origin and its insertion, ঠিক আছে? Talking about pectoralis major, এটার origin হচ্ছে from the clavicle, from the sternum, and from the ribs, okay? First 6 costal ribs, and এটার insertion হচ্ছে into a region in the humerus, but এটাতে আমরা পরে আসছি, okay? We'll come to this later on. Pectoralis minor. Pectoralis minor is another muscle. It's a small muscle. Its origin is from the ribs, first third and fourth costal ribs, and its insertion is into the coracoid process of the scapula. এটাতে আমরা পরে আসবো, no need to worry. After that, serratus anterior. Serratus anterior is another large muscle which gets attached to the scapula, origin being from the first 8 ribs, okay? 8 digitations are there of this muscle which get attached into the scapula. Deltoid muscle, it is attached to the clavicle, it is attached to a part of the scapula, and also it is attached to the humerus. The attachment on the humerus is its insertion, ঠিক আছে? So keep these muscles in your mind, right? You should be very much familiar with these muscles. Talking about the clavicle, this is your clavicle bone. So it is also called the collarbone, and এটার description যদি বলতে হয়, first you need to determine its side, কোন সাইডে আছে, and for that you need to consider some points, okay? So এই যে এটা দেখতে পাচ্ছিস, a quadrangular shaped end, this is your medial end, it's a broad end, also called the sternal end. This is flat, this end is flat, and it's called the acromial end, right? It's the lateral end. এবার anteriorly, on the anterior surface, the clavicle has a convex curvature and then it has a concave curvature, right? So এটা মাথায় রাখতে হবে। and inferiorly এখানে একটা টিউবারকেল আছে, ঠিক আছে, টিউবারকেল আছে and একটা trapezoid ridge আছে, right? So keeping these points in mind, you need to determine its side. আমার কাছে যে বোনটা আছে, the bone which I have is a left sided clavicle. Okay, this is your anatomical position. You are seeing it from the behind, that's why don't get confused. This is how you have to hold in front of your examiner, right? This is a clavicle's anatomical position. Left sided clavicle, you need to hold it in your left side, right? Okay, so coming to the medial end, the medial end has is broad, okay, it's quadrangular and it gets attached to the sternum. The part of the sternum is also called the clavicular notch to form the sternoclavicular joint, like this. See this, right? This is how you need to like understand it. You don't need to hold this sternum now, okay? You don't need to learn about the sternum. For your understanding, I am showing you this. So the clavicle is formed by medial 2/3. There is a medial 2/3 and there is a lateral 1/3. Okay, so talking about the medial 2/3, it has a superior surface, an anterior surface, a posterior surface and an inferior surface, right? The superior surface and the anterior surface, right? This part has a muscle called the pectoralis major muscle. As I said, the pectoralis major muscle has an attachment on the clavicle. This part, the anterior surface and the superior surface on the medial end has the attachment of pectoralis major. ঠিক আছে? আচ্ছা, okay, coming to the coming to its inferior surface. Inferior surface near the medial end there is attachment of costoclavicular ligament. Okay, there is attachment of costoclavicular ligament. And on the posterior surface, posterior na bollo, on the superior, okay, somewhat on the superior surface there is attachment of another muscle called the sternocleidomastoid. Okay, sternocleidomastoid, it's a muscle of your neck, right? Sternocleidomastoid, it looks like this, see. And the other part gets attached to the head. Okay, so this is how the sternocleidomastoid is actually attached. This is a clavicle and this is a medial end. Here the sternocleidomastoid gets attached. Okay, so now the posterior surface. Okay, so the concave posterior surface of the medial end, the concave posterior surface of the medial end is associated with the following structures, namely the subclavian artery, subclavian vein, the internal jugular vein, the brachiocephalic veins, right? These are all your neck vessels. These are all your neck vessels. So coming to the lateral end. The lateral end. Before coming to the lateral end, another thing which I forgot to tell you all, on the inferior surface of the medial two-third, there is a longitudinal groove here. Okay, there is a longitudinal groove here for the attachment of the muscle subclavius. Subclavius is a small muscle, right? Subclavius looks like this. See this. It gets attached to the first costal rib, right? This is a subclavius and this is a clavicle, right? Right. Now coming to the lateral end. The lateral end also has a superior surface, an anterior surface, a posterior surface, and an inferior surface. Right? On the superior surface and the anterior surface gets attached your deltoid muscle, right? On your superior surface and the anterior surface of the lateral end gets attached the deltoid muscle, while on your superior surface and posterior surface of the lateral end gets attached the कौन muscle था? The trapezius muscle. Okay, the trapezius muscle will come into will learn about it in details in your head and neck part, right? The trapezius muscle gets attached to the posterior and superior surface of the lateral end. Lateral end, this is flat and it's called the acromial end because it gets attached to the acromial process of the scapula. There is a process in your spine of the scapula which is called the acromial process, right? Don't have to get worried about it now. We'll come to it later. Now at the junction of the medial two-third and lateral one-third, there is a ridge. Okay, this ridge is called the conoid ridge, right? A conoid, no sir, not a ridge, it's a tubercle. Okay, it's called the conoid tubercle, right? And just near to the acromial end on the inferior surface there is a ridge. This is a ridge which is called the trapezoid ridge. Okay. Now to the conoid tubercle and the trapezoid ridge get attached the conoid and the trapezoid parts of the coracoclavicular ligament. The coracoclavicular ligament is attached to the coracoid process of the scapula. It's another process in the scapula, and to this conoid and trapezoid parts, the conoid tubercle and the trapezoid ridge. Okay, the coracoclavicular ligament, right? So Kiki, summarizing all the muscle attachments, Kiki muscle gulo bollam. Lateral ende on the lateral one-third, on the superior and anterior surfaces attached is the deltoid muscle. On the superior and posterior surface are attached the trapezius muscle. On the medial end, on the medial two-third, in the anterior surface is attached the pectoralis major muscle. On the superior surface, on the medial two-third is attached the sternocleidomastoid muscle. On the inferior surface In the longitudinal groove, here there is a longitudinal groove, you will feel it. There is attached the subclavius muscle, and key ligaments আমি বললাম, near the medial end here there is attachment of costoclavicular ligament, which connects the first rib and the clavicle. That's why it's called costoclavicular ligament. And at the lateral end there is attachment of the conoid and trapezoid parts of the coracoclavicular ligament. Right? Coracoclavicular ligament. These are all your major muscles which are attached to the clavicle. The clavicle, the entire superior surface of the clavicle is covered by skin and platysma. Right? It's covered by skin and platysma. And between these four muscles, the deltoid, trapezius, pectoralis major and sternocleidomastoid, 3 branches of the supraclavicular nerve, okay, pass over the superior surface. The intermediate branch might pierce through this bone, right? So 3 branches of the supraclavicular nerve, they pass over this superior surface. The clavicle forms the base of two triangles between the trapezius and the sternocleidomastoid on the posterior surface. Okay, on the posterior aspect between the trapezius and the sternocleidomastoid, the clavicle forms the base of the posterior triangle of your neck, while between the deltoid and pectoralis major on the anterior aspect, the clavicle forms the base of the deltopectoral triangle. Right? The deltopectoral triangle. Now there are 2 explain whys regarding the clavicle. Number 1, clavicle is a modified long bone. What is the function of a long bone? To transmit weight of the body to other parts, right? It's the characteristic feature of a long bone. And clavicle acts as a strut which transmits the weight of the appendicular skeleton of your upper limbs to the axial skeleton, right? It also allows movement about the scapula in all directions in your shoulder joint, right? And it keeps the appendicular skeleton, that is your upper limb, separated from your axial skeleton, right? These are the functions of the clavicle, which makes it a long bone. Now why is it a modified long bone? Well, it is the only long bone which has no medullary cavity, right? This is point number 1. Point number 2, it is the only long bone which has 2 primary centers. It ossifies by 2 primary centers, one for the medial 2/3, another for the lateral 1/3. It is the first bone to start its ossification and the last bone to complete its ossification by the age of 25 years, right? It is the only bone through which the intermediate branch of the supraclavicular nerve might pass through. In some bones it passes through the nerve passes through the clavicle. In others it might not. Okay, right? It might possibly pass through the clavicle, the supraclavicular nerve. Yes, these are your points. These are all your points to be given. And yes, another last point is, it is the only long bone which ossifies in membrane, right? Except its medial end, which ossifies in cartilage. So ossification is membranocartilaginous. These are your points. for this explain why. First explain why question. The second one being clavicle is fractured commonly at lateral 1/3 and medial 2/3 junction. Why? 2 points are there. 2 points. First of all, the lateral 1/3 and the medial 2/3 get attached at this point only. Okay, at the point where you have the conoid tubercle, right? This part is the weakest point. The fusion part, the part where the fusion occurs, is the weakest point. And since the conoid tubercle is present here, it gives attachment to the coracoclavicular ligament. So all the weight of the upper limb gets transmitted to this region first. This region, fusion region of the clavicle, because of which it might get fractured sometimes. Okay, it gets commonly fractured. Yes, sir. So these are your 2 points which you have to mention for this explain why. And this is all about clavicle. We'll be talking about scapula in my next video. So thank you and happy studying.